All right, hello everyone. Welcome to our vital signs workshop with Divya and I. Um, Thank you for taking the time off your day to just come out and learn a couple of things that, trust me, are going to be well needed if you're ever interested in becoming a CNA or MA or anything that's patient care related. Please make sure that you use the barcode for the attendance, and as well, if that doesn't work for you, please check out the chat. I already put in the Google form that you need to fill out. This is recorded, so if you do want to go back and watch this again, it will be recorded and it'll be in the email that we sent out.
And also feel free to turn your cameras on if you want.
Yes, you'd love to see your faces. Please turn them on.
Okay, so let's get started. This is just a disclaimer. So this workshop presentation is not an official or professional vital sign course by Temple. It's brought to you by our organization, and it's only to present you with basic knowledge of taking vital signs in hopes to help you guys for your direct patient contact experience. And it does not replace an actual CNA certification training or on-the-job training. It's just to give you background knowledge about everything. Okay.
Okay, so what are vital signs? Vital signs are measurements of the body most basic functions. So usually measured at doctor's offices, often as part of your health checkup, or just regularly, just making sure you're okay. If you to go to the emergency room for a visit, or it's also useful in detecting or monitoring medical problems. So let's say, for example, if your temperature's too high, that could be a sign of a fever. It can be measured in medical settings at home or a site of a medical emergency or anywhere else. So they're really important to figure out what's going on in your body. They're just used to make sure that you are okay. And if you're not okay, we can figure out what's going on. On my right, I don't know if it's your left, but you can see an example of vital signs that we take. We have our temperature, we have what type of temperature source we use, which I will go over on later. We have heart rate, we have what type of heart rate machine that we used, and respirations as well. I will definitely go over that. BP, and where and what we use for BP, as well as oxygen pulse. Oxygen saturation, the oxygen device, and the percentage as well.
And this could be something that you see, like if you work in a hospital setting, this is just called a flow sheet. And you can see the time is up here as well. Again, just a quick summary. The vital signs we're going to be covering are temperature, blood pressure, heart rate and pulse, and respirations, as well as oxygen saturation. So these are the typical instruments and devices used that you could see potentially in your jobs. Dynamaps are typically used in hospitals. So they take blood pressure, heart rate, pulse, and oxygen saturation. So the patient, you put the cuff on them and then connect it directly to this machine. And then also simple manual blood pressure cuff with a stethoscope. We'll be covering that as well. A pulse oximeter, also known as a pulse ox, used for, obviously your pulse and your oxygen saturation. And then a thermometer used for temperature. It's a simple probe one. This can be used orally or axillary, which is under your arm. And then this is a temporal one.
So first things first is temperature. A temperature check is usually part of a routine visit to your healthcare provider or emergency room, or anywhere that you go to. They will check your temperature, especially right now with COVID. It's a big thing. It's used to make sure that there's nothing going on, that your temperature is not overheating or too low. Temperature is one of your vital signs, and it's important. It's an important indicator of your health. A normal body temperature is 98.6. So if you ever measure yourself, that is your normal body temperature. Anything under 95 degrees Fahrenheit is considered hypothermia, so you are very cold. And anything over 100.4 degrees Fahrenheit is considered a fever. These are the different types of temperature checks. So if you ever work as a CNA or MA or anything in patient care, these are the things that you should know and you will be using. tympanic ear temperature sometimes is used for kids. It's not more so used for adults as much, but you can check your temperature through your ear. Temporal, which is on the temporal artery or the side of your forehead where I'm pointing at. Um, Nowadays we use it for COVID, but it's also used for kids mostly. Rectally, yes, it does go up your butt, and pretty much we're adults here. Pretty much is it's very accurate, believe it or not. Axillary, which literally means under your armpit, and orally, which is under your tongue. A couple things that you guys should know of. Give me 1 second. Just pull up my notes. Um, so an average normal oral temperature, like I said, is 98.6. A rectal temperature is about 1 degree higher than an oral temperature. So if you ever get a rectal temperature done, it's a little bit higher than a oral one. That's perfectly fine. It's considered normal. An ear temperature is also higher than an oral temperature by 1 degree. Armpit is usually 1 degree lower than your oral temperature, which again is 98.5, 98.6, excuse me. And a forehead, which is temporal, is usually about 1 degree lower as well. So those are just a couple things that I will put in the PowerPoint as well. Just notes to you guys to know. So just to figure out which one is one more accurate than the other. It's a couple things you guys definitely need to know. So it's pretty cool. A couple things, couple ways of us can find different types of temperatures. If one thing doesn't work, we have an alternative.
And also I want to note, like, the closer you're getting the temperature, like, to the core of your body, like, the more accurate it is. So usually they would prefer, sublingual or like under the arm or like directly straight from an artery.
Right.
Okay, 1 second. Okay, so now we're gonna cover manual blood pressure. So the materials you would need are a blood pressure cuff, one that fits correctly, with a pump, and this is a big word. You probably might have heard it before if you took anatomy lab and learned about blood pressure, but it's called a sphygmomanometer, and it's the monitor or like the pressure gauge that you read when you get your blood pressure, and then a stethoscope. And yeah, the sphygmomanometer is the thing on the side right there. So the patient setup, usually you want them to be sitting upright with their upper arm parallel to like their heart. You don't want their legs to be crossed, and you don't want them to be standing up or laying down unless directed otherwise. Which would be, right here, things to know. A patient may require to have a tilt test done, and sometimes it's known as getting tilts done. The nurse might ask you to grab these before you go in to get the patient's vitals. So this means that you're taking their blood pressure when they lay down, when they are sitting, and then also when they're standing to be compared later. And this could be done to figure out why a patient has been feeling faint recently. Also, the cuff should not be too loose or too tight. You typically want room for 2 fingers to get a more accurate reading. And I actually have props. So I have a stethoscope here with me, as well as a blood pressure cuff. I just got it to practice. I got it from CVS. It was probably like $14. Wait 1 second. Let me just see what's in the chat. A tilt testing was an orthostatic BP. I think it is because I've seen both of those words together before,
Yeah,
but
it
guitar
is the same.
is the same.
Yeah.
Okay, yeah, so it's the same. Thank you for your question. But yeah, I got this set at CVS. I was just practicing on my family. Yeah, so here we go. We have the sphygmomanometer, or just the gauge, and then like a really cheap stethoscope. The stethoscope actually came with it, which is really handy.
And you guys can get this at your local CVS or Rite Aid, or
Yeah, like Amazon or something. Yeah. Yeah. So, because it would be kind of hard to demonstrate, and for you guys to actually hear the sounds, I'm gonna show you this video, and she'll show you exactly how to take blood pressure, and then later on we'll see examples of like what you would actually be hearing.
Hey everyone, it's Sarah with RegisteredNurseRN.com, and today I'm going to demonstrate how to check a blood pressure manually. First, you'll need to perform hand hygiene and gather your supplies. You'll need a stethoscope and a manual blood pressure cuff. So let's measure a blood pressure manually. To do that, we want to make sure a patient is sitting down with their arm at heart level and their legs are uncrossed. Now, if they're lying in bed, you would want to make sure that this arm is at heart level. Then what we're going to do is we are going to get our stethoscope and our blood pressure cuff. And you want to make sure you get the right size cuff for your patient's arm, because if you use too big of a cuff or too small of a cuff. Hey everyone, it's Sarah with Registered Nurse RN.com.
Can you guys hear? No, I think she stopped. Okay.
Sorry, I was unmuted. I was muted. But are you guys able to see, or is it lagging really bad?
It's like lagging pretty much. I can hear it, but the visuals are.
You can hear it. Okay. Okay. If not, I can actually.
And they can watch it.
Yeah, I can just quickly demonstrate, but I won't actually like use a stethoscope. But basically, on the blood pressure cuff, you are aligning it to the brachial artery, which is the artery that's like on your upper arm. And that's what divides past your elbow into your radial and ulnar artery. And typically on a cuff, there is a marker. Let me just stop sharing real quick so you guys can see. Okay, so there's usually a little line, there's a circle and a line, and that's usually what you would align with the brachial artery. So I'll just do that really quick. It's kind of cool to like do it on yourself as well. Okay, so it's aligned with my brachial artery. And what you need to do is make sure your gauge is visible. You need to tighten it all the way. So righty tighty, tighten it all the way. And you would put the stethoscope right underneath, like you would tuck it right underneath the cuff, right on top of your brachial artery. I don't know if you can see. And then obviously put the stethoscope in your ear so you can hear. I'm not going to do that. So when it's tightened all the way, you want to pump it up to 140 or 160, around there. That's usually what I do. So I'm going to do that really quick. And then later on, we'll actually like listen to what you should hear. And then you slowly release. So just a tiny bit. And then you see the gauge kind of going down. Not that fast. But you should hear and also see the pin like ticking a little bit. You'll also hear like a heartbeat type noise. So if I share this again, sorry. Okay, we'll talk about what those sounds you're hearing are. So the first sound, typically around the 120 range, that's the systolic blood pressure. And that's when the heart ventricles contract. And that's when blood is ejected to the arteries and to the rest of the body. So you have to note down when you heard that first sound. That is your top number. And then it'll keep ticking, you'll keep hearing the beats. And then you have to make sure you hear when you have to make sure you take note of when you hear the last sound. And that's typically around the 80 mark. You know, like 120 over 80 is the average blood pressure. So the last sound is the diastolic blood pressure, and that's when the heart's ventricles relax and the blood fills again after returning from the rest of the body. So again, first sound is the top number. Last sound is the diastolic blood pressure. And if you want to confirm what you thought, just take it again. And so you just to make sure you didn't hear anything like wrong, just to double check your blood pressure that you got on your patient. So this is just a summary of what I just did. And notify the nurse of abnormal blood pressure. So anything less than 100 or greater than 140. And that's for the top number, so the systolic number. And then anything less than 60 or greater than 90 for the diastolic blood pressure or the bottom number. Yeah, if it's greater than 140 or greater than 90, that usually is what hypertension is, but we don't have to go into those technical details. Okay. So hopefully this doesn't lag as much, but it's like a 20-second video. So this is where you'll be able to actually hear the beats. So hopefully it's not too laggy and you can actually see when it's lining up. so hopefully you were able to actually like see that and hear it.
Any guesses before?
Sorry. Any guesses as to what it was? You can...
I'm not sure what the first number was, but I think the second number was around 60 or 65.
Okay.
Okay, good guess. Anyone else?
Maybe it was laggy, but I'll show you the answer. And again, these are on YouTube. So yeah, it was 98/68. So very, very close. We'll just do one more. It's being really... Okay, that might have been a little more laggy than the last one, but was anyone able to make a guess? Maybe not. Okay. So that one was 112/76. Apologize for the lagging, but again, these practice ones are on YouTube. There's so many. Okay. Guitar.
Why is my mic not, okay, I'm like, why is my mic not working? Okay, so the third one is pulse and heart rate. So where is your heart rate? How can I figure out my heart rate? What is a pulse? Your heart rate is basically how many times your heart pumps out blood to your body. The best places you can find are your wrists, which is your radial, inside your elbow, which is right here. It's just your brachial, like Divya pointed out, with blood pressure. Side of your neck, which is choroid, which is right little bit under your ear. And top of your foot, which is your dorsalis pedis. Yeah, I know. I found out about this yesterday. It's actually pretty cool. To get the most accurate reading, put your finger over your pulse and count the number of beats in 60 seconds. So if we're doing it radially, you can actually find it around here. Sometimes you have to press just a little bit, but once you feel a heartbeat, count for 60 seconds, figure out your heartbeat. Another way, which is usually what I do at my job, I count for about 15 seconds. If the heart rate machine doesn't work for me, count about 15 seconds, multiply by 4, and you get your beats per minute. So let's just say I counted 18 beats for 16 seconds. I multiply that by 4, I get 72 beats per minute, which is a great heart rate. Your resting heart rate is the heart rate pumping the lowest amount of blood you need because you're not exercising. If you're sitting or lying and you're calm, relaxed, and are not sick, your heart is normally between 60 beats per minute and 100 beats per minute. So as an example, 72 beats per minute is typically a good heart rate. What is a good heart rate? So I got this from the American Heart Association, so I think this is 100% accurate. Between your 20s, 100, 170 beats per minute, 30s until your 70s, it kind of gradually slows down just a little bit. And it's only because we're getting older and our bodies tend to work a little more harder. So let's just say in your 50s, you're about 85 to 145 beats per minute. So if you ever have a patient, let's say male, 45, what their heart rate should be around? It should be between 88 and 149 beats per minute. So let's do a little practice. So I have about 4 people on here, different types of ages. Does anyone guess who has a really good heart rate? Actually, I'm sorry. Does anyone want to guess who has a bad heart rate? Excuse me.
I thought like normally at least anything above 110 is like considered high. But like is 126 like can you go back to the previous slide?
Yeah, I was about to ask if you wanted to.
If anyone wants to go back, it's perfectly fine.
Cuz like I thought 170 was like high for like a 20-year-old.
170 is high for a 20-year-old.
I'm
but
surprised that's like in the target range is what I'm saying.
it's normally for like someone who's pretty much let's say like you're running around consistently, not more so exercising, but you just happen to just walk around really fast or something like that. Our heart tends to pump a lot.
Mm-hmm.
So it is high, but usually between, I would say, 100 120 it should be okay.
I think it's just showing a larger range.
Yeah, it's showing more so a larger range.
So I'll just go back to this one. Okay. So
Anybody want to guess?
Is it Peter? I feel like 60 might be a little too low.
Yep, it's Peter. So if you go back to the chart, Divya, if you don't mind.
Yeah.
The 30s, it should be between 95 and 162. Like I said, 120 is pretty good, but you're right, it is a little low for Peter for his age. Thank you, Sam.
Okay. So now I'm going to talk about respirations or respiratory rate. So respirations are the number of breaths a person takes per minute, and it's usually measured when a person is at rest, and it involves like counting the number of breaths for 1 minute, and that's how many times the chest rises and falls. Respiration rates may increase with fever, illness, or other medical conditions. And when checking respiration, it's important to note whether a person has any difficult breathing while you're checking their respirations as well. So we need to count the number of chest rises and falls. So a rise and a fall is 1 respiration, and you typically would just count it for 30 seconds and then double it. Usually there's a clock in the room. If not, it's usually recommended to wear a watch if you're a patient care tech or anything like that. Normal respirations for adults, it's 14 to 20 respirations per minute. Under 14 and over 25 respirations is considered abnormal. And right now, especially with COVID, respirations are something that we like to keep a close eye on in case they're having a lot of difficulty breathing.
Also, just a tip. If you do respirations, please do not tell your patient that you are doing respirations, because they will start breathing heavily or stop breathing at one point. So it messes up your count. So just probably be like, hey, I'm just going to check your heart rate one more time, but you're not checking it, and just look at the reps.
Mhm.
So right now we're going to talk about oxygen saturation, or AKA pulse ox. As Divya mentioned, the types of machines we use, we have a pulse oximeter. You don't have, this is something I use at home, but if you work in a hospital setting, they have a different type of machine, but it's the same readings and the same use. Your blood oxygen level is to measure how much oxygen your red blood cells or hemoglobin are carrying. Your body closely regulates your blood oxygen level. Maintaining the precise balance of oxygen saturated blood is vital to your health. So pretty much a fancy way of saying how much oxygen your body is getting to all the organs. It's not more so how much oxygen you're breathing in, it's how much oxygen your organs are getting. People with chronic health conditions may need to monitor their blood oxygen level. This includes asthma, heart disease, chronic obstructive pulmonary disease. In practice, the oxygen saturation range is 92 to 100% is acceptable for most people. Some experts suggest that the level should be at least 90%. If you want to talk COVID related, anything under 90 is concerning. If you are a little bit older, anything under, let's say if you are in your 50s, anything under 93 is concerning. And we'll talk about that in the next slide. So just to give you a general idea, ages 0 to 18, just a quite little tip, newborns tend to have a lower pulse ox in the beginning, which is perfectly normal, but it should be between 97 to 100%. Ages 18 to 30, teens to young, 95 to 100%. And middle age is also 95 to 100%, which is 30 to 50 years old. Ages 50 and up, 94 to 100%. As we get older, we tend to have a hard time getting that pulse ox up a little bit. And then just the dangers of having low oxygen levels. So sometimes it could be from shortness of breath, chest pain, confusion, headache, rapid heartbeat, or in our case, COVID or bronchitis, pneumonia. It gives us a little bit of hard time. And sometimes we can't really tell, which is why those little pulse oximeters are really come in handy. But it's really interesting. I think I have something in the chat. Did we stop sharing? No. Divya, I think you are sharing your screen, right?
Yeah, I'm sharing it. If you're looking at it on your iPhone, maybe you have to swipe to your right or left to see the shared screen. Maybe I think that might be the case.
That might be the case. But yes, those are just a couple things that if you feel like your oxygen levels are too low, these might be a couple things that you might want to look at. Like I said, if it's anything under 90, I highly suggest you go to the ER if you have any chronic conditions. And then pretty much our summary. So this is pretty much our vitals for vital signs workshop in a way. So this is if you ever go to your doctor or emergency room or anything like that, this is what you pretty much look at. You have your heart rate, which is a great number right there. Our blood pressure, that is a great BP right there. Oxygen saturation, reps, and your temperature. So if you ever go to an ED or your doctor's office and you happen to see the machine, kind of figure out what it is.
Okay. Okay, and that's it. I know it was pretty quick. It was about 30 minutes, but does anyone have any questions that we might not have covered? Or anything at all? No. Here's the attendance as well. Feel free to stay back or anything, or put anything in the chat if you have any questions.
And I put the attendance form one more time again too in the chat.
Okay. Are all of you guys like currently trying to find patient contact hours? Where are you guys at right now?
I'm personally trying to just find a job right now.
Mm-hmm. Yeah. Okay, so will we have access to these slides? Yes, we'll share them. And you're welcome.
Oh, cool. That's awesome, Sarah.
Hospital. Cool.
Yeah, if you guys don't have any questions or anything that you would like to share, you feel free to go. If you want to talk about anything as far as PCA or vital signs, please do feel free to turn on your mic.
Yeah. In the process of trying to find a patient care tech or MA job. Yes.
Yeah, it is a little difficult.
Mm-hmm. Have you been like looking online or looking at Indeed? I know that's like the best place to find these jobs. Someone else is
Also, don't feel discouraged, guys. Like it does take a while for to apply. Like I applied about 16 times to get a job.
Mm-hmm. You're welcome.
Absolutely. Yeah.
Cool. Thank you guys.
Thank you guys for coming.
Mm-hmm. Feel free to like chat or message us or email us if you have any questions.
I actually have a question.
Yeah.
Go ahead.
So I'm a sophomore right now, and I'm still looking for a patient